Ebola in 5 minutes. Ebola. This word has become so frightening. Wait, hold on. Let's do this right.
Ebola. This word has become so frightening for many of us in the recent years.
Officials in the Democratic Republic of Congo have declared a new outbreak of Ebola.
In this video, we will help explain exactly what Ebola is, so you can get to know your enemy and let go of the fear. Ebola is the name of a virus almost exclusive to the western and central parts of the African continent, named after the Ebola River in 1976, where the virus was first recognized. The most recent outbreak took place in the Democratic Republic of Congo, and it currently continues to claim human lives. There are as many as 5 types of Ebola strains. However, only 4 of them are known to cause disease in humans. Ebola virus has been found to live for up to 7 days on a dead body, which is why handling the dead poses a great risk. With a high degree of virulence, lethality, and the capacity to spread quickly within the healthcare settings or heavily populated areas, Ebola is a serious public health threat. Ebola can be transmitted through direct contact with blood or various body fluids, sharing of objects such as needles or syringes of a person who is sick with or has died from Ebola virus disease. In addition, the infected fruit bats or non-human primates such as apes and monkeys, which are believed to be the source of origination of this disease, can also transmit the virus. As for the reservoir host of the virus, it has still not been positively identified. Ebola cannot be transmitted when a person shows no signs or symptoms through consumption of food, with the exception of bushmeat, a term used for meat that comes from apes, bats, and other similar animals caught in the wild, which have been linked to the spread of the Ebola virus. The incubation period for Ebola on average is 8 to 10 days, but can range anywhere from 2 to 21 days. The symptoms often include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained hemorrhage. In order to be diagnosed with a case of the Ebola virus disease, the patient needs to exhibit a number of characteristic symptoms in combination with a history of possible exposure to the virus within 21 days prior to the onset of symptoms. Treatment for Ebola includes providing fluids and electrolytes through an IV infusion, oxygen therapy in order to maintain adequate tissue oxygenation, medication used to reduce vomiting, diarrhea, pain, fever, as well as maintain blood pressure. Currently, no FDA-approved antiviral medication to treat the Ebola virus disease has been released, but an experimental vaccine was found to be highly protective in a trial conducted by the World Health Organization. In order to avoid becoming infected with Ebola, you must follow these recommendations. Use proper hand hygiene. Avoid contact with blood and body fluids such as urine, feces, saliva, sweat, vomit, breast milk, semen, and vaginal fluids. Avoid items that may have come in contact with an infected person's blood or body fluids, such as clothes, bedding, needles, and medical equipment. Avoid funeral or burial rituals that require handling the body of someone who died from the Ebola virus disease. Avoid contact with pets and primates, as well as blood, fluids, and raw meat prepared from these animals, or meat that comes from an unknown source. Avoid contact with semen from a man who had the Ebola virus disease until you know the semen is free of the virus. If you happen to travel to an area affected by Ebola, upon returning home, monitor your health for 21 days and seek medical care immediately if you develop symptoms of Ebola virus disease. If a person shows early signs of Ebola virus disease and has had a possible exposure, he should be isolated immediately, and public health authorities need to be notified.